Assalamu alaikum and good morning. The audience must be familiar with dengue fever. Each year, we have large outbreaks of dengue fever in Pakistan, in which thousands of people across the country are admitted to hospitals. Sometimes our hospitals are overflowing with these patients with dengue fever. Our physicians, doctors, nursing, and paramedical staff work overtime to cater for the needs of these patients. Most of these patients get better and go back to their lives. Some lose their life. In this process, some doctors and nurses also conduct some form of research on dengue fever and publish that. But that's all what we do. And this cycle repeats itself again and again and again. We need to understand that what else we can do that would ensure that the number of cases decrease and we do not face the same situation each year. What if we go beyond our routine medical care and research and we start collaborating with other disciplines and specialties? For example, clinicians collaborating with public health experts to understand the dynamic of dengue outbreak, how it occurs, how it spreads, maybe to collaborate with engineers to design better mosquito traps that can actually reduce the incidence of dengue fever in those communities, or maybe with entomologists for studying the entomological pattern and surveillance of the disease and the transmission pattern of this dengue fever, or maybe with social scientists to understand how does the community respond to these measures, what is their level of awareness, and what are the prevention strategies that can actually be implemented in these community which we serve. And maybe this interdisciplinary approach could lead to more effective solution and maybe a reduced incidence of dengue in the years to come. Floods are very common in Pakistan. Every year almost we have floods over large area of Pakistan, and whenever there is a flood, there are outbreaks of infectious disease. Medical teams and medical professionals, they run to that area, they provide medical service, and then they come back. And this cycle again repeats itself year after year after year. Again, why don't we collaborate with people outside medical community, for example, with engineers who can design and deploy rapid water purification systems, which can actually provide immediate access to clean drinking water, which can reduce the incidence of these infectious diseases, or maybe with data scientists who can analyze data from different sources and they can actually track the spread of these waterborne disease so that our response is proactive instead of being reactive, which we are doing nowadays. Or maybe collaborating with public health experts who work on the ground, who assess the health situation and needs of the population, and who implement disease prevention strategies in those communities. Or maybe with environmental scientists who can actually go and study the impact of floods on those communities, ecosystem, and water sources, which are actually a source for infectious disease. The question is, if we know all these things, why we are not doing that? ये दायरों का सफर कब तक जारी रहेगा? In which we repeat the same thing and the same kind of research again and again, year after year after year. Probably one of the reasons is a lack of interdisciplinary collaboration. And my today's talk is focused on the value of interdisciplinary collaboration as a key to bridge research gaps in medicine, particularly in context of a developing country like Pakistan. I'm Dr. Farooq Rathore, working as a professor and head of Department of Rehabilitation Medicine at the Quetta Institute of Medical Sciences. Although there are certain subtle differences between these terminologies, but for the ease and for understanding, I'm going to use these words as interdisciplinary, multidisciplinary, cross-disciplinary, and transdisciplinary in the same meaning for this presentation. Now, what is interdisciplinary research? It is the research that involves collaboration and integration of multiple academic disciplines or subjects or field of studies in order to address a complex problem or a complex research question, because a complex problem cannot be solved with your usual routine methodologies. It is a research that combines concepts, methodologies, and theories which are drawn from two or more disciplines, which could be within medicine, subspecialties, or even outside medicine. There are certain advantages of interdisciplinary research. First is comprehensive understanding. By drawing on different perspectives and expertise, interdisciplinary research can provide a more holistic and nuanced understanding of a given issue at hand. You will be able to develop novel insights because the intersection of different disciplines and subjects can lead to discovery of unexpected connection, innovative solution, and emergence of new fields which you cannot understand with your own lens. Then practical application. This interdisciplinary approach often gives you a greater understanding into the complexities of the real world problems. And there's a synergistic learning. Why? because researchers from different backgrounds and different subjects can learn from each other, and it would lead to a better and enriched medical education experience. And the ultimate outcome of this interdisciplinary collaboration and research is going to be better patient outcome, better patient satisfaction, a better quality of life, and reduced mortality and morbidity, which ultimately benefits the whole society. Despite this fact, there are certain barriers in interdisciplinary research. There are many, but I'm going to discuss top 5, and they include the medical professional nature of the medical profession, the lack of common language, structural and bureaucratic changes, lack of dedicated funding, and limited opportunities for cross-fertilization. Starting with medical professionals who work in silos. I mean, we always talk of medical healthcare, the teamwork and stuff like that. But honestly, because of specialization and subspecialization, we are now limited to a very limited area of human body. Everyone treats his or her own area and then sends the patient away to another person. So very rarely a physician or a specialist would have a holistic understanding of the problem that the patient is facing. And same goes for research. Everyone is doing research in their own very specific narrow field: cardiology, orthopedic, neurology, ophthalmology, ENT, and they do not have understanding of the other person's perspective. And honestly speaking, just pause for a moment and just imagine, when was the last time that you actually actively collaborated or sat down with your colleague who was not from your specialty over a cup of tea to maybe discuss something from another perspective, from their own specialty? Honestly, outside medical care, we do not collaborate usually. And you can address this, number one, by creating what we call an interprofessional education program and an early exposure to this interdisciplinary research at the undergraduate level. I'll give you a couple of examples. For example, in case of rehabilitation medicine, probably it would be a good idea that resident in rehabilitation medicine, they sit down together with maybe students in physical therapy, occupational therapy, prosthetic and orthotics, or maybe speech and language pathology to understand the holistic management of stroke rehabilitation. Or maybe people from cardiology can sit with cardiac surgeons or maybe with cardiac perfusionists in order to understand that what is and how the management of a patient with maybe cardiac surgery can be improved. Or maybe optometrist can learn along the ophthalmologist. So we have to go for this model of interprofessional education if we want to promote interdisciplinary research. And for that, it is absolutely important that you have to respect the other person's profession, value their expertise, and listen to them. And for that, you have to move out of your comfort zone and listen to their unique perspective, which you might like or not like. And this is the problem with the medical community. Unfortunately, many of the doctors have this arrogant attitude where they think that only they know everything. And anyone from other healthcare specialty, whether they are nursing, paramedical staff, they don't have the understanding that the doctor Saab has. You need to get out of this mentality if you want to promote interprofessional collaboration and interdisciplinary research. Second issue is that of lack of common language understanding. Different specialties and different subjects and different backgrounds and different vocabulary. For example, different researcher would use different terminologies and all of them might not be familiar with those terminologies. Methodologies differ across specialties. Medicine has a different kind of specialty when it comes to randomized controlled trial. Computer science follow different kind of methodologies. Maybe agricultural science have their own methodologies. Social science have their own methodologies. And sometimes we are not aware of the methodology that the other person is employing to get an answer to that question in research. And then theoretical frameworks. So for example, in medical science, usually we do a lot of quantitative research, data collection, right? But for example, in case of social sciences and psychology, they do a lot of qualitative research. So you need to understand other person's perspective and to understand their language in order to do collaboration. This can be first of all addressed by actively reaching out to other professionals, a proactive approach in which you ask the other person sensibly and respectfully to tell you what do their terminologies mean. What are the methodologies that they use in order to answer a research question? That methodology might be different from your methodology, but there's a possibility that is the correct methodology that you need to focus on if you want to get an answer. And another way could be whenever we have our conferences, seminars, so it might be a good idea to invest in the kind of workshop, seminars, and training session that foster a shared understanding of concept. So people come and they describe what do they do in their research, and then you describe what do you do, and then you try to find the common ground. Because unless you don't find a common ground and you have a lack of common language, you can't move forward with the interdisciplinary research approach. And if you do that, It's going to build a bridge where an effective dialogue can be done. And that dialogue is going to be the first stepping stone in order to create a culture where interdisciplinary research can be conducted. Usually, university and institutes have a rigid structure, and there are traditional discipline and departments, and that's totally okay. This is how the world works. So, for example, a large university might have a medical school, a nursing school, a dental school, a school of computer sciences, a school of law, a school of social sciences, stuff like that, right? But the problem is, how do these different schools and different departments and different institutes under a same university collaborate? All of them are doing research in their own domains, but how do they collaborate in an interprofessional sort of like interdisciplinary manner? Because things are not clear. For example, I mean, how do they share resources if they apply for a same grant? And if something is created out of that research, who will own that intellectual property right to that thing? So these things are not very clear. And one way of addressing is, number one, the university or the institution should make very simplified workflow approval processes. People don't have to go to like 20 clerks in order to get an approval. It should be very streamlined. And then you should have very clear intellectual property guideline. Who is going to own that program, who is going to own the data, and who is going to own the outcome once it is published. Then budgeting is always a headache, and you should have very clear, transparent guidelines on how the budget will be allocated, to whom the budget will be allocated, and on which basis. That is the transparent resource allocation. Then this is a very important thing, the IRB and the ERC approval. People who are not working in medical healthcare sciences, they sometimes do not realize the value of getting an institutional review board or ethic review committee approval before the startup process. So you as medical healthcare professional, if you are collaborating with colleagues from data science, computer science, agricultural science, you have to make them realize the value of getting an ERC or IRB approval, and you have to sort of facilitate that process. And then probably you might want to have a designated support staff for the interdisciplinary collaborative approach to research. So you have a research department, and then you have a sub department where people are sitting only to facilitate the interdisciplinary collaboration across different departments and subjects. Funding is a major issue. Whether you like it or not, unfortunately, there's little or no fund for education and research in this country. You want to see some proof? So look at these trends in the last 35 years. And this is a very unfortunate graph. Most of it is in red, which means that we have not been investing in education in the last 35 years. And this means if you don't have money for education, the research is the next byproduct of education. If you don't have money for education, how are you going to invest for research? And again, people might get offended, but unfortunately, the research grants, the funds, they would actually prioritize established medical disciplines, because usually people don't want to take risk. They want to do research in some question or in some subject where the outcomes are almost like confirmed, and you know what the outcome is going to be, and they don't want to take risk and spend money where they have no clue that what is going to be the outcome of this collaborative research between Department of, let's say, medicine and Department of AI, Department of cardiology and Department of engineering, and it goes on. How to address? Again, if you ask me, in a country which is begging IMF for funding, it is very unlikely that you're going to get funds from the country or from your own institute. So simply go global. And by global, I mean there are many organizations out there who would fund a good grant proposal. The only catch is they are not going to give this funding to individuals. This has to be done through institutions, and this has to be done through departments. And some of the examples include National Science Foundation of USA, National Institute of Health USA, Fogarty Grants of USA, Wellcome Trust UK, and Bill and Melinda Gates Foundation. This is not an exhaustive list. There are many other organizations out there who are funding developing country in interdisciplinary research. And to the best of my knowledge, I might be wrong, but to the best of my knowledge, there's only one institute in this country who has been making the best use of these grants, Aga Khan University, Karachi. In the last 30 years, they have won multiple grants of more than millions of dollars for this kind of interdisciplinary collaboration. So अगर आपके मुल्क में अगर एक इदारा इन चीज़ों पे काम कर रहा है, so आप और हम उस पे काम क्यों नहीं कर सकते? I really wish that KMU takes a lead in KPK, and maybe the next Fogarty grant, the next NIH grant, you might want to apply for that. Then there are limited opportunities for cross fertilization of ideas. Why? because our events, our conferences, our seminar are hyper focused. And by hyper focused, I mean there is a seminar on cardiology. So you would see only cardiologists. You will not see a neurologist going into a conference of cardiology. If it is a conference on orthopedic, all the topics are going to be from orthopedic research. There is not going to be any other topic from psychiatry or some other subject that can actually influence the outcome in orthopedic, and it goes on. Then publication are siloed. We have specialty journals which only publish specialty research. They do not publish cross-cultural and cross-disciplinary research. And then because of all these things, for youngsters especially and young faculty member, there are very limited opportunity for interdisciplinary collaboration and networking. And this ultimately limits the exchange of ideas, and it can actually discourage the researcher from venturing outside their comfort zone. Then they say, okay, I'm going to do research in my own specialty because things are clear, I will get the support, and it would be easy for me to complete my project. Instead, that I start collaborating with some other department and the outcome might not be what I expected. So how to address that? Number one, you might want to do cross-disciplinary tracks. So please encourage your mainstream medical conferences to include at least some specific tracks which are dedicated to interdisciplinary and cross-disciplinary research. So for example, if it is a conference on cardiology, why can't they have a session where they discuss the implication of nanotechnology in cardiology? So you get people expert in nanotechnology who are non-physician to cardiology conferences, and same goes for any other specialty. You might want to encourage publication in, or you might want to establish cross-disciplinary journals or publication, for example, Nature Biomedical Engineering or PLOS One. Now, these are the cross-disciplinary journals which publish cross-disciplinary and interdisciplinary research. They are not only hyper-focused on medical sciences, and these are good opportunities. And then you might want to have these interdisciplinary networking event in which you, for example, a professor in, let's say, in neurology invites someone from other subject or other department so that they can discuss their perspective on management and research in neurology or how it can be improved. Unless you don't listen to other people's perspective, unless you don't allow them to express themselves, you are not going to get different and diverse perspectives because we are very hyper focused. And hopefully this can then result in a culture where collaboration is the norm. So how to break down barrier in interdisciplinary research? I would say every stakeholder has a responsibility, and the responsibility starts from medical student, resident, and trainees. Number one, you are living in 21st century. You have to explore beyond your core curriculum. The number of resources you have, your teachers, and we never had those resources. Take courses or attend seminar outside your core specialty, outside medicine. Explore other things, and it would give you knowledge which will help you holistically explore a human body and research when it comes to you. Then please try to create one or join interdisciplinary student group. So you might want to join a group of students who are working on AI or nanotechnology or maybe something else. And then you might want to actively seek opportunities for interdisciplinary and cross-disciplinary research project. Please remember, जब आप स्टूडेंट्स होते हो ना यार, तो आपके पास बहुत अपॉर्चुनिटीज होती हैं. जब आप फैकल्टी बन जाते हो तो आप मुकाबले पे आ जाते हो. इसलिए when you're faculty, a consultant, a senior professional, people are a little bit hesitant in collaborating with you. But if you are a student in any specialty, in any field, people are very open toward you because they don't see you as a threat. And you should actually explore that as an opportunity and go for interdisciplinary and cross-disciplinary research projects. For faculty member, number one, you have a responsibility. You have the power to drive interdisciplinary research in your own department. So next time, maybe while preparing research proposal, invite colleagues from other departments, other discipline, maybe computer science, economic, environmental science. Now this collaborative approach will increase the scope of the research, but also its real world impact out there. And then you should encourage your students to pursue interdisciplinary projects instead of focusing only on their own core subject. And they should connect the dot between medicine and other discipline, show them how this integration can lead to better outcomes and how it can make the world a better place. If you can arrange, please organize interdisciplinary seminars and workshops. Host these seminars because they can foster collaboration, invite speakers from different fields, create platform where students can express themselves, other people can express themselves. And then please invite experts from other subject and area, because if you invite professionals from field like data science, anthropology, even arts, humanity to share their knowledge. These guest lectures or workshops will offer a very fresh perspective and a different viewpoint that can enhance this value of interdisciplinary. If you are a dean, head of department, or head of institute, please do these things. Establish dedicated interdisciplinary funding because this financial support will encourage your faculty, your students to pursue interdisciplinary research and collaboration without the usual financial constraints. Please incentivize this interdisciplinary collaboration. Recognize it probably by tenure and promotion process. You should acknowledge this collaborative research in institutional matrix because it will motivate your faculty member to collaborate across different fields and even partner with non-medical entities. To truly embrace interdisciplinary research, you have to partner with non-medical institutes such as technology firms, governmental agencies, and NGOs. And this partnership can bring fresh insight and more resources that medical institute nowadays direly. The summary is that research culture in Pakistan is improving despite significant challenges. We are facing many hurdles, but the commitment to growth is very clearly visible and we are on the right path. Despite the fact interdisciplinary research is still an untapped opportunity in our country. By exploring this area, we can discover new ways to solve complex problems in healthcare. All stakeholders, whether students, residents, faculty, deans, administrator, policymaker, we have a responsibility to encourage interdisciplinary research because only being together we can push for more collaboration between different fields. And this can ultimately lead to better solution and improved patient outcomes because collaboration leads to innovation and progress in making a true difference in patients' life. I thank you all for your patient listening. If you need a copy of the presentation or you have any comments and addition or feedback on this presentation, I'll be happy to answer that. Thank you very much.